I think wanted to become a physician probably in middle school, actually. My mother was diagnosed with breast cancer at that time, and watching her go through like all of her chemotherapy, then surgery, really kind of sparked this like interest in medicine for me. I started volunteering more in the hospital in high school, and then when I moved to undergraduate, I really focused my studies on pre-medical education and cellular and molecular biology. And then eventually when I moved on to medical school, I really had an interest in oncology, and I thought I was going to do more of the medical oncology standpoint, but I fell in love on my surgical rotations, and I just thought that was like the perfect fit. I wanted to become a colon and rectal surgeon because of the breadth of the specialty. We treat a lot of patients with benign as well as malignant disease, as well as a plethora of other problems such as like pelvic floor disease and anal rectal disease. And I think from a career satisfaction standpoint, I mean, if we get to cure patients with cancer, we get to follow them long term, but we can also help patients who don't necessarily have cancer but have really life-altering or life-impacting conditions. When I see patients with a cancer diagnosis, I think some of their biggest concerns are really what this means for me over the next few months. So patients typically with a colon cancer, they may just go up front with surgery first and then maybe chemotherapy later based on what their pathology shows, unless that cancer has already spread elsewhere, in which we may change the treatment for that. For patients with rectal cancer or anal cancer, a lot of patients are really worried what that means in the long term. Like, what is your function going to be? Does this mean they may have to have some sort of stoma or a bag? And what is the treatment course? So I think that really, we spend a lot of time counseling our patients, especially, for example, with rectal cancer, if that means doing radiation first, then chemotherapy, and then talking about surgery down the road. But really, a lot of that depends on where that lesion or where that cancer is located and what that means in relation to their function, how they're doing already, and then what sort of options that they have from a surgical standpoint. So I primarily see patients in Siteman, North County, and I think this institution and this location is so fantastic for patients, especially who live maybe in Illinois or northern St. Louis, and it just makes that ease of care a lot more accessible for patients. And we have with our facility with many different physician services as well. We have radiology, we have an emergency department right there as well, and it just makes things a lot easier for patients to get their care a little bit closer to home. And we bring these essentially world-renowned services from Siteman to these surrounding communities, and I think making that care more accessible for everyone makes things better for everyone.